NHMRC, National Health and Medical Research Council, said that of Dr. Holt's work, after they supposedly investigated it for a year, that he was wrong and people would be wise to continue chemical killing. Well, they actually called it chemotherapy. They said that's the answer. Ray Martin from Channel 9, he's personally spoke to 50 cancer patients with radiotherapy treatments who were still alive 10, 20, 30 years after the medical profession had pronounced them as good as dead. Would the NHMRC investigate these and other people? No, it was just anecdotal, just stories, didn't mean anything. So Ross's wife, Jenny Barlow, was here to tell us about the remarkable Dr. John Holt and radiotherapy treatment from Sydney. Let's welcome Jenny.
And repeat thank you to everyone. We've got action. I've heard that word action, and that's what I'm after. Okay, thank you for the introduction. Thank you for Robert. I have invited myself. I did ask for 10 minutes, and he's been very generous in giving me the half an hour. I feel a bit the inexperienced speaker on the block, but I hope that I can be informative and that I will motivate you to action. I certainly have a passion, as you will see, and I definitely have some very clear messages. 30 years ago, I was school captain of Gunnedah High, so it gives you an idea of my age, and that's when I have really last spoken to the last 6 months. But my grandfather always said, yes, talking is bred into the females of our family. So here goes. Our family has been 6 generations on the land, all over the place within the Gunnedah Boggabri districts. But tonight I'm actually going to talk about the radiowave therapy and generally about cancer in general and why I'm so passionate to see change. As we've already been told, my husband Ross, 2 years ago we had a minor car accident just above the Port Stephens cutting near Tamworth, and he was rushed back to Tamworth Base, and it was discovered for the first time that he had multiple myeloma. Multiple myeloma is a blood cancer and it affects the bones. It actually erodes bones. He was given a few cycles of chemotherapy. From there he was transferred to Newcastle, a few cycles of chemotherapy and some radiation. After that, the only other option for myeloma is stem cell. But stem cell treatment involves a lot more chemotherapy and it depends on the mix of drugs. And also he was diagnosed at 3rd stage and he was weakened after the accident. After the accident though, he had a bit of a sore back, but you know, farmers have sore backs, so I can tell you we did not expect this bombshell to hit. Once he refused stem cell, and it takes a lot of courage, believe you me, to step outside of the system. But when he said he would not undergo stem cell treatment, he was given 2 years to live. Sometimes you can have a second stem cell, but really that is about all. So for us, the options weren't that wonderful. Like so many of you, I'm sure, I actually saw quickly while Ross was in Newcastle Hospital, only 5 minutes of Dr. Holt's the program on a current affair, Elvina, who's head of the support group, a young girl that had her leg removed because of bone cancer, and then she had lung cancer, 4 spots on the lung. She was told she was very close to dying. They couldn't do any more. So, and they were told to take her home and for her to die. The medical profession was very upset when her family said, no, we're going to West Australia. Well, off they went, and she had only 2 treatments, which is 2 treatments over 6 weeks. That's 10 years ago. She's walked the Olgas, and I hope one day that she'll come over to New South Wales and we will see her as the living proof, because we don't have the science proof yet. I can promise you, I understand that. It has been drummed down my neck. But I have to work with the living proof for the time being. And remember, I'm the one that's lost my husband, but I still have total, utter faith in Dr. Holt. In fact, we didn't meet him in West Australia because it was 5 months before he could treat Ross. We actually met him in Ireland. He was over there setting up research. So Ross, I got on to the doctor. It took me a couple of months to get on to the doctor in Ireland. He was just setting up. There was lots of complications to get there. But of course we did go. But it was still probably 5 months from the time Ross was originally diagnosed. Ross became patient number 6. And the treatment is fairly simple, and I'll talk about it in a minute. And each time he went, his pain relief improved, because when you've got a bone cancer, normally blood to bone cancer, the pain is very hard to control, and the majority of multiple myeloma patients become paralysed. So what happened in Australia, Ross chose to have thalidomide. That was what was suggested by his blood doctor. We've only had probably 5 big fights in our life, that was one. But the patient has to make their own decisions. But I kept daily records and 4 times a day, and it was quite obvious looking back that when they doubled and tripled the dose, there was an infection. But it was very mild. 2 Panadol would take it away, and also he was on steroids, so it tends to mask the infection. It was then that he had a perforation of the bowel. He actually died of complications to the bowel. I don't know whether he would have lived or not, but I can tell you that thalidomide did become toxic, and I think for everyone there's a warning. Read the small print. I didn't think we read enough of the small print. He had had a rash that was very severe. It was easy then to look back and find that. But basically patients die of complications. They do not die of the cancer itself. So despite Ross losing his volatile to live, I do have complete faith in Dr. Holt's work. And basically, what is radiotherapy about? It capitalises on the fact that the energy process in a normal cell is different to a cancer cell. And Dr. Holt examined work way back in 1920 of a German scientist, Warburg. Warburg found that in a tumour cell there's virtually no oxygen, whereas in a normal cell there's lots of oxygen. Probably the simplest explanation, my bottles have become smaller. It's either have an empty one and then they wonder what happened to the wine. But in a bottle of wine, you have, as in the fermentation process, the wine is sealed. You have no oxygen. Now that is like what it's with the tumour and in the body. When you undo the lid, the oxygen comes in and the wine spoils, and so does the tumour. So it is wrong when people say you're opened up with an operation and it's the operation, the air spreads the cancer. No, it is actually the reverse. I constantly ask Dr. Holt the questions. I'm in communication with him all the time. It is because you've cut the oxygen supply to the tumour, and that's why it spreads. So the more oxygen you get into your body, the better off you are, whether it's through exercise, green food. There's heaps of research. I'm just not there about radio waves. You have to do other things. It's ownership of your own body's health. So there's more stuff. There's plenty on the theory. This is the unpublished. These are published notes. I have is unpublished. Unfortunately, I haven't got it up on screen. Please take the time to look at these. This is a mouth ulcer. The mouth is half gone. You will see the bottom one. It is healed, and it healed without plastic surgery after the radio wave treatment. That book is full of miracles. You can see I almost said that FOOK. I've been to Ireland too many times. To be honest, the part that is John Holt's invention is that he has an injection of glutathione that he puts in, which is amino acids. It goes through the body, full of oxygen, attaches to the tumour cells, and they say, whoopee, this is a sugar hit. It's not, they got tricked. It's full of oxygen. You just go under a small antenna, which is in a room as big as this. I could be trained in a day. It's so simple. And they oxidise off the cancer cell, and it doesn't hurt your normal cell, and that is why I am so convinced we have to look differently at the treatment of cancer. Dr. Holt said it is quixotic, that you can't, he wouldn't say you can't cure everyone. He hasn't cured everyone, but I'll tell you what, he's cured the terminal ones, the one he has. He hasn't got people, virtually they've all come in wheelchairs or very, very, late in their disease. I just can't believe that the MRC report that was done after current affair, it has compared terminal patients, here's a terminal with what I call first and second stage with chemotherapy. You have to ask, why would they even bother to do the comparison? They looked at this many of his patients. They wouldn't interview anyone. None of the panel from the MRC went to Western Australia. Forgetting all that, I think it costs hundreds of thousands of dollars. It wasn't done in detail. We didn't look at tumour size. We didn't look at the state of the patient before. We didn't look at what before. We need a proper analysis, not a straight statistical on, and their statistical analysis was all of the things around the world. They even brought a study in that did radiation and radio waves. What rubbish. Dr. Holt has never, ever done radiation, radio waves. Yes, he's done the reverse, but he hasn't done it that way. What a waste of money and a waste of time. I'm currently in negotiation with Anthony Abbott, his mother calls him that, and Mr. Rudd, and at the end I'll ask you why I need help quickly. We need the biological study, and that's when I met Dr. Holt in Ireland. How come Ireland has been able to give the time and the money to set up a biological study? John Holt has never been offered money from either government or any other body, and honestly $100,000 a year would be more than enough to really get it going. And you don't need millions of dollars. Warburg did the research in the 1920s. The Kosovo husband and wife scientists in Israel still alive have done some work. There's heaps of work, heaps of stuff out there that has been ignored. Plus, we've had the genius in our country. He is a genius. He came first, not just in England, first in his medical exams in the UK, in the world. He had a full scholarship in England. He has 6 degrees, 22 letters behind his name. This is not a quack. And as well, he was given a Medicare rebate by the Gough-Whitlam government and had it for 30 years. And this is why I'm speaking out at this time, because above everything else, I felt guilty at times we had a choice. But for 30 years, all Australians had a choice because the Medicare rebate was there. The new clinic started 18 months ago. That has been removed. And why? It is the same treatment, and it is cost effective. 5 treatments in Ireland is half the cost of a year's chemotherapy. Now it costs $7,000 for 3 weeks. That is not a choice for all. I want you to have a choice. I think at the very least your taxpayers' money should go towards choice. Do you agree?
Yes.
So I am currently asking for time to see the government. I don't want to just take a science proposal or send it. I want to meet them in Canberra. And I have been suggested to call a press conference and say to the folks, well, I can't get in the door. I hope it doesn't come to that. But basically, you can tell I might be small and I'm not a rugby player, but I do have a competitive spirit, and I believe Ireland is getting in front. I know they will publish and I know we'll have the benefits of it. But I want to be there too with research, because we are Australian, and it's an Australian, I'm told, discovery. Invention, I don't care. It's Australian. And he is a very wonderful man, Dr. Holt. And if you think about it, he's been criticised for not publishing earlier. But on one of the current affairs shows, you will see, one of the doctors said he popped his head up, and like a turtle, he was bang each time. He got sick of popping his head up. Plus, both his partners were elderly. They've both died. So he was left as a one-man show. And really, when you've got terminal patients, did he go on to publish, or should he gone on, which he did, to treat his patients? Just quickly to Ross's story, after he had the hole in the bowel, 7 times we were told he would not live. He would die in hours or days. One Sunday, it was actually my birthday, I exercised what it's called right of kin, where I asked the senior doctor to release him from hospital. They told me he was dying of his blood disease, but I asked for his blood results, and his blood results showed that it was very stable. I didn't know what had happened. He'd gone in with a bowel infection and he lost his mind in 2 days. He couldn't walk, he couldn't talk, and he was very weak. But I had made the decision that he wasn't going to die in hospital. I had an electric bed at home, and I decided to take him home and feed him and see how he got on. I took him home, and they kept saying, he'll die. I said, just get him in the car, something's not right. Took him home, we unloaded him at home. In 2 days, he walked, and he talked, and in 3 weeks, he went back to Ireland. Number 1, he'd been treated for the bowel, but not the bladder. Fortunately, they had sent him home on a different antibiotic, but they had failed to see that he had a urinary tract. Urinary tract for men is debilitating. Is that the word? It doesn't sound right. It's close. It takes away their mind in 2 days. I thought he'd had, Dr. Jenny thought he'd had a psychotic episode. I didn't know, but I knew the answer was not there with the medical profession. But don't get me wrong, I don't have no resentment at all. In fact, I actually believe I came across so many wonderful people in the hospital system. But on the same token, I'm asking people to think seriously. When you're in hospital, my message is you must have an advocate, particularly if there's some sort of confusion. You must have someone to help. And particularly boys, you better take the litmus paper. If your urine starts to go, get yourself out. A doctor finds it hard to rise above a diagnosis. But remember, I've been with a patient for longer than them, and it is the complications that prove fatal. I did spend a couple of weeks another time in hospital. I have a huge respect for nurses. I believe they're underpaid, overworked. There's huge things that need addressing there. I've never worked so hard in my life as I was in hospital when I had the confusion. I might be small, however, I'm determined. Thank you. I must be a little bit, I'm determined. I'm fiercely determined, and I'm fiercely committed. I want to move forward now. I want to look for change. I want you as the public, I believe in democracy, that you have to exercise your vote, and that's why I'm after Anthony Abbott and those boys down in Canberra, because it's the federal one I'm after. Even though I eventually want a clinic in New South Wales and many places, I know it's the research that we have to get on with, and I want that Medicare rebate back. It's no reason it shouldn't be there. The treatment is the same, and it is non-destructive. I can't help repeating that one. If you take away nothing else, remember that word. I don't want to take away from whatever path you choose with cancer, because I think it is your path. What I'm saying is to try to open your mind and to raise awareness and to go away from today and say, Jenny Barlow is on a quest. She has seen another way. She believes she's seen a better way. And I want you to tell as many people as you can. I have petitions here to sign today. I'm petitioning both governments, and I intend to continually work through the wider electorate, because that's obviously mine, but certainly to fan out more in the next 8 months. Our local media have been very good to support me. But as I said, I don't want to take away people's hope, because at times that's all you do have is your hope. You have to choose your path, and even if there's some other alternative things. But I don't see this as alternative. John Holt has got the science and the answers. Okay, it's not fully explained yet, but okay, Einstein took 15 years to explain his theory of relativity. So what? Are we going to wait for all the science to be in, or are we going to get on with the job? So I can only say that it is the research we need to get on with. And I suppose so many people ask me, why hasn't it changed? Why has Dr. Holt been ignored? It's definitely the best kept secret in Western Australia for 30 years, I know that one. Don't know what's wrong with the doctors over there, but obviously they're going to take away their jobs, because to be honest, the GPs have been on side, but you can see, I can feel a bit sorry for the oncologists. They've trained for years just in chemotherapy, and so I'm probably in a way challenging their jobs. Don't get me wrong, leukemia, hugely successful with chemotherapy. So is Hodgkinson, non-Hodgkinson, and testicular. But the girls, you don't have to worry about that one, but there's thousands of others you do. So 4 billion goes in each year for chemotherapy in America. There's millions in Australia. I don't know the figures, but you can work it out for yourself. It is a big business, and I suppose I actually feel better after following you, because I'm thinking, oh, I'm the Australian government. I want to challenge people to ask them questions. Gee, Dave's taking on the American government. So I felt a bit, I actually was relieved following you, because sometimes it feels like Everest. I think my Everest is a fair size. I think your Everest is a bit bigger again, but not impossible. And I think that's what it is. I believe it is the people, and it is the influential that I want to bring together. I don't think the influential will do it alone. I don't think the public will do it alone. It'll be everyone together. And I truly believe it is that connection of people, and you're using your spoken word or your written word to the ministers, whatever you're feeling comfortable with, that's what you need to do. So, just finally, I don't think, do we need statistics? Do I need to force this issue? I think most people have been touched by cancer. It is rising. It is a global problem. It is actually an epidemic of the Western world. If people just say now to you, no, you've got to die of cancer, so something, cancer, well, second on the list, no. People are living longer, but I believe it's only because of early detection. The death rates have basically not changed, and to be honest, they take the markers from 5 years. So if you die at 5 years one day, you're not counted in the figures. So, to be honest, I believe I don't have to force the issue, that it is affecting more people. I don't think I'm any more special. I think people are being touched. Probably getting just close to the end. I have made eight trips to Ireland in the last couple of years, and to the UK. We've had 5 for treatment, and our son has now coincidentally married an Irish girl in Belfast Castle, and now they've returned here. My daughter's working London, Dublin. I'm sure I didn't make all those trips to see the leprechauns. I'm sure Elder Green Grass, I've gone for a purpose, and I believe now I'm choosing very definitely that I want to speak out, even though I haven't hardly done it in 30 years. I do believe the treatment of cancer has to change. We have to open our minds to other things. Real intelligence is when you've got an open mind, not a closed mind. I can stand anyone criticising something, but they must do their homework. So when doctors tell me, or even other people, this report, that report, fine if they've done their homework, but please don't criticise unless you have done your homework. And as I can say, Dr Holt has never had anyone from government or any organisation go and spend time with him. And really at this stage he has only trained the doctor in West Australia and Ireland. So that's why we have to move now, because he is 81 and a half. It's my other reason. So this is my compelling cause and my calling, and I don't want radio waves just to be for a few. I want it to be for all, and I believe that above everything else, that a pill will never fix cancer.
Yeah.
It just won't do it. It's remission, and I want more than a remission. I want to see the cures that Dr Holt has done, considering he's got them at late stage. I've got a support group that will take in Ireland, England, Australia. I've also got a trust fund, Michael Baxter. Fortunately, he's my solicitor, and that connection might prove very handy in the future. There's a couple of others have come on board, 7 scientists and doctors recently in Sydney. And I will need their science fine-tuning to take me to Canberra. But I have it. More and more people are coming on board. And the question for the public is, what would you choose if you are diagnosed with cancer? What choices would you make? Finally, I feel fortunate. Despite everything, because I have been blessed, many supportive friends and family. I've also had an almost perfect marriage for 30 years. And from that, this is my thank you to Dr Holt, the team in Ireland, my wonderful husband, and our wonderful marriage. And that's why I am speaking out, because I am asking for people for their support. I need you very quickly in the next few days. I need emails and letters into Tony Abbott and Kevin Rudd, because I need to get to Canberra, preferably this Parliament, in the next fortnight. There is a website, radiowavebarlow.com. The form letters should be on tomorrow, and I need those letters, and if otherwise send your own letter, I don't care. I'm just winding up now that radiowavebarlow.com. I don't know whether we'll get a chance, but otherwise someone might see if they didn't see current affair, they might be able to see that at some later time. I look forward to the day that radiowave therapy is recognised as a primary option, not an alternative. I must emphasise it has to be a primary one. You need to raise awareness. I'm raising it. I need people. I can lead, I have vision, but I need the people. And my heart tells me I'm being personally challenged. And if I walk away with it, and I'm not going to, I intend to persist, and that's my message to Canberra, that science is definitely going to happen. And I've always had strength. I have never been so tested as in the last couple of years. But it's uninvented, and there is steel underneath, and I'm speaking out purely because I care, and I believe I've seen a better way. Please take that message away.
A woman is fighting for mainstream medicine to acknowledge an alternative cancer therapy that prolonged her husband's life. Jenny Barlow is planning a rally to give sufferers more choice and better outcomes.
Jenny Barlow's husband died on Valentine's Day last year. Ross was diagnosed with a cancer of the blood and sentenced to 4 rounds of chemotherapy. The cancer remained. Ross was given 3 months to live. But after undergoing radiowave therapy in Ireland, the pain lessened and he lived another 12 months.
We were fortunate to be able to choose something different, and I want that for other people. I have seen a better way.
Radiowave therapy has been practiced in Perth for 30 years. It works on the basis that tumour cells behave differently than normal cells and can be isolated and then zapped by radio waves. It saved many patients once considered terminal.
The living proof is there. I know the scientific proof isn't there yet, but that is coming.
Irish researchers are studying the technique, but in Australia it's already been discounted and taken off Medicare. Analysis showed it had the same success rate as chemotherapy, but Jenny says the comparison wasn't fair. It's usually only terminal cases that come to radiowave therapy.
A statistical analysis isn't adequate. We need a we need a biological study.
Jenny wants both state and federal governments to chip in money to fund research and establish a clinic on the eastern seaboard. She's planning a rally and petition signing on the 16th of February in Gunnedah. Near Gunnedah, Jay Lynch, Prime News.
But first, cancer. It's the illness we probably all fear most. We all know somebody who's had it or someone who's battling it. Over the years, I've reported on countless alternative therapies and cancer quacks who've ripped people off and offered false hope. I guess I'm as sceptical as anybody. Well, 6 months ago, when we began investigating a remarkable Perth surgeon named Dr John Holt and his radio wave cancer treatment, I was still sceptical. What makes Dr Holt different, I guess, is that he didn't want any publicity. But we kept hearing from patients, and dozens of them, who insist that he has saved their lives when the rest of the medical profession had nothing more to offer.
3 weeks to 3 months.
6 months to live.
Your life's at stake. The stakes are pretty high.
Do you owe your life to Dr Holt?
Oh, every day of it. Every day of the last 28 years. There was just no way I could have lived. It was just impossible. Just couldn't have happened.
I just started university, so I was a little bit wild, enjoying life. I can't explain what that's like to be told. At 18 in particular, when you're supposed to just begin life, it's like everything had ended.
So frightening.
All my brothers were there.
I remember when the day that they took her down to take the leg off, and I was in the lift with her, and she was grabbing my hand saying, "Mum, please don't let them do it, please, Mum." I wanted to die that day.
Elvina Johnson had a lot of living to do.
when she was suddenly told she also had an aggressive form of bone cancer. But they didn't say it was terminal at that stage, did they?
No, but just, you know the word, and you know what usually happens. I started chemotherapy, then I had to lose my leg, unfortunately. It wasn't something that we had planned or the oncologist had planned, but my cancer was so severe. After that, I continued on with chemo again, the heavy duty stuff, and then I relapsed in the lungs while I was under chemo.
What, more cancer?
Yep, secondaries in the lungs. It was through both of my lungs, and it was, by that stage, it was pretty terminal.
Did they tell you that?
Yeah, their words were that I had a few months where I could either use experimental chemo more as palliative care, or I could spend some time with my family.
At 18, Elvina wasn't ready to hang up the guitar. Desperate, and quite by chance, she heard about a cancer specialist in Perth, a highly qualified doctor with a highly controversial procedure.
But by taking that chance and finding this man, I'm here 6 years later and feeling better than probably I ever have.
Remember when we used to work in the garden together?
She was a skeleton, you know, very, very sick child, and a couple of times we thought we were going to lose her.
And I believe that Dr Holt did save her life.
Well, somebody certainly saved Sophia. After 2 brain tumours and a spinal tumour, Sophia's family had almost given up. What did they say that this third tumour would do to her?
The worst, like
Really?
paralysed.
As the tumour would progress to increase the size of the spinal cord, it would cut off. Her lungs use would not function anymore, so she would eventually...
Wouldn't be able to breathe and so on.
Wouldn't be able to breathe, it would kill her.
Did they say that they had any cure for that they could treat it in Sydney?
They couldn't do nothing.
Did they give you any sort of time span?
Anything from a couple of months to 6 months at the longest.
One doctor said to me, don't even take Sophie as far as Perth because she won't even make it.
Sophie, so be careful, okay?
Today, 2 years after they went to Perth, the only signs that Sophia ever had cancer are the side effects from the massive doses of chemotherapy she was given in Sydney. Charlie Teo, Sophia's doctor and one of the world's preeminent brain surgeons, told her parents to give Dr Holt a go.
I didn't know much about Dr Holt, but I did know that a few patients of mine had been there and he'd helped them, so I felt that I should keep an open mind to it, and I said, you know, just try it.
So what happened when she came back after the treatment from Dr Holt?
Well, she came back in a good clinical state, and in fact her MRI scan showed that those white dots that were getting bigger had disappeared.
How do you explain that?
Well, it's hard, Ray. I mean, I'd like to say that it was the microwave therapy, and it probably was.
The first day I said to Mum that I felt like I knew how a vegetable felt when it was getting cooked, or a French fry.
Or a French fry. In layman's terms, what this highly qualified surgeon does, and has been doing for 30 years, is give the patient an injection of a glucose-blocking agent. He then shines radio waves into the body at a specific frequency. Dr Holt doesn't guarantee it will cure every cancer, but it's not expensive and there's no quackery about it. It's not painful and there are no side effects.
No side effects. Well, sure, when you're in there, it's very hot and hot for about half an hour and you get a bit tired for about an hour after, but then we went sightseeing for the rest of the afternoons.
When I first walked in, I thought, well, hold on, where's all the pain? I mean, you get a little bit warm and you get a needle and that's it. So I'm thinking, okay, something's going to happen any second. I'm waiting for it, and nothing ever did.
Now, remember, Elvina had what was called a galaxy of tumours. She was riddled with cancer. First her leg, then in quick time, it moved into her lungs and was threatening her heart. That was 6 years ago.
I'm stronger than I think I ever have been.
But you have had any side effects from the Dr Holt treatment that you know of?
No, none.
No.
No. But other side effects from the chemo?
Yeah, the usual side effects that people get with chemo. That kidneys and my heart needs to be checked often, and I've lost some hearing in my ears, things like that, just from the actual drugs, but nothing from Dr Holt's.
So who is this mystery medicine man that they're all talking about? Well, his name is Dr John Holt. He was born in Bristol, England, 80 years ago. He was a boy genius, and he went on to become a surgeon, a radiologist, a gynaecologist, and an obstetrician. He's a member of the Royal Colleges. He's got 22 medical letters after his name. For more than a decade, he was in charge of WA's main cancer research institute, until the 1970s, when his medical colleagues and the politicians blacklisted him.
The doctors took up such an action initially. They said that the treatment was fake and useless.
Former WA Labor Premier John Tonkin was the exception. He was Holt's greatest supporter, even though it cost him his job. The new government of Sir Charles Court quickly banned the use of Holt's machine in Perth's public hospital. Still, Tonkin told this program back in 1990 he owed his life to Holt's controversial cancer treatment.
There's no doubt whatever in my mind that this is the most advanced form of cancer treatment in the world today.
John Holt has been so badly mauled in the processes. If I'd have been through his experience, I'd have been stark staring mad, I guess, because this man undoubtedly has been deliberately crucified, and he didn't deserve it.
John Wickham used to be town clerk for the city of Wollongong. John Steinke was the Dean of Commerce at Wollongong University. Old mates and old cancer victims, they owe their lives to Dr. Holt. For the best part of 20 years, they've been trying to tell their story.
My urologist said, I don't know what your man in Perth has, but he obviously has something. Because when you went away, you had a thriving tumor, and that's 18 years ago. There has never been any sign of reoccurrence.
Has no one offered an ear to you, John?
No, no. And nobody, as far as I'm concerned and as far as I can find out, nobody in the last 15 years has talked to John Holt.
It's an unproven form of cancer treatment, and it's not part of the armoury of orthodox ways of treating cancer in Australia.
Clive Deverell was the boss of the WA Cancer Council for 20 years. The terrible irony is that Clive is now also suffering from an incurable cancer.
I've seen them all over 20 years of working in this field, from Dr Milan Brick, who was again acclaimed as a genius.
But Holt's not a quack.
Certainly not. He's a very highly qualified doctor, he's a physician, he's an expert in radiotherapy and physics, but he still hasn't produced the scientific evidence.
After years of attacks and vilification, with threats of legal action and even deregistration, you'd expect that he might be a bitter and twisted old man. Well, he's not. But if Dr. Holt can do what he and hundreds of his cancer patients say he can do, then why hasn't he been recognised? Well, we don't know the answer to that. What we do know is it's been a long medical and scientific standoff.
It's been torrid. We've seen one man being vilified by his peers, being persecuted as he saw it by the National Health and Medical Research Council.
This vitriolic attack, written in 1974, concluded that Dr. Holt's therapy was ineffective and undesirable, but it was also harmful. The NH and MRC now tell us the report has long been out of date. In fact, this is the only copy in existence, collecting dust in the Fremantle Hospital Library. But for 30 years, it's badly damaged, maybe even irreparably damaged, Dr. John Holt's reputation.
As a human being, as a father of children, as someone who I hope is reasonably compassionate, I have no problem with it. As a scientist, I should have a problem with it because before I endorse a treatment, I should insist on seeing the scientific data.
What if he's right? Where does that leave the Cancer Foundation?
I can't answer for the Cancer Foundation, but I can answer for myself as a cancer patient. It would be a crying shame.
But Clive, if Dr. Holt is right, that's the sort of thing that they win Nobel Prizes for.
Certainly right.
Sometimes I think maybe Sophie's reason for getting sick was so people would know about Dr. Holt.
Beautiful face. Remarkable story, isn't it? As we said, how come we don't know about it? As we said earlier, Dr. Holt didn't want any of this publicity. He hasn't spoken to the press, I guess, for 15 years, and he's never done a television interview. So it took us many months to persuade him to finally talk to us.
Its great advantage is that what I do has no side effects.
For the first time in 2.5 years, the tumours hadn't grown.
You've heard some amazing testimonials from his patients, and you're probably wondering what Dr Holt charges for this treatment. Well, after all the rebates that can be claimed on Medicare, on average it's a bit over $1,000 for 3 weeks of treatment. It's pretty obvious that Dr Holt is not after money or fame, and with no side effects from his therapy, he certainly deserves a better deal from the medical establishment than he's had so far. Dr Holt, thank you for your time.
Pleasure.
Now, a lot of people we've spoken to believe that you saved their lives. Did you do that?
I hope so, yes. That's what I aim to do. I think so.
Have you succeeded, though, where other specialists haven't?
Oh, undoubtedly.
Does it please you? Does it satisfy you to think that these people see you as a miracle worker, as a saviour?
Oh, yes, it's very gratifying. But it really is nothing more than the chance discovery of a machine that would make X-ray therapy universally effective.
In person, John Holt is quietly spoken, old-fashioned polite, and surprisingly humble for a man whose patients worship him. Are you more convinced today than you were 30 years ago that you're on the right track?
Absolutely.
Do you think that what you're doing is far superior to chemotherapy?
Its great advantage is that what I do has no side effects. I've tested the blood function, the biochemical functions, liver and kidneys of every one of the patients that I've used it on, which is many thousand, and I haven't found a signal abnormality.
Would it be fair to say that a majority or many of your cases, you're really getting people as a last resort? They're on death's doorstep anyway?
Most of them are, yes.
I've had 2 years of chemotherapy, radiotherapy and surgery, 5 different types of chemo, and 6 months ago I was told there's nothing more for me.
This is just a tiny part of a nationwide support group we've spoken to over the past 5 months. They all insist that they owe their lives to Dr Holt.
For the first time in 2.5 years, the tumours hadn't grown. Everything was stable.
I had no choice. I was going to have my bladder out.
And had you been told that you were...
6 months to live.
Where was your cancer? Or what kind?
The mesothelioma.
From asbestos?
Yes.
How long ago was that?
In 1991, beginning 91.
The first day that I went to see Dr Holt, I was sitting in his waiting room. I must have looked rather nervous, and there was an old lady sitting opposite. And she said, "Don't worry, dear." She was Italian. She said, "Look at me." She said, "They told me to go away and die. I had cancer of liver." She said, "Look at me 10 years later, baby, you'll be all right," like that. And I thought, well, isn't that fantastic?
Now, they all think he's fantastic.
Very scientific approach.
Dr Holt's support group has spent 20 years writing to health ministers, cancer experts, prime ministers and premiers. But all their letters have been ignored or rejected. In 1991, the WA Cancer Council finished its long trial of Dr Holt's treatment. It cost them $136,000. Dr Holt says it was a bogus trial, just the latest in a long campaign to try and discredit him. He says it was conducted under duress, that they chose an unsuitable cancer, a rectal cancer, and that the scientist didn't even understand how his treatment works.
There are some of the cancers like lymphomas and Hodgkin's disease and some of the early breast cancers, and particularly bladder cancer, which respond magnificently.
Do you ever say you can cure cancer?
No.
Why not?
Well, you may not.
They were massive. You'd feel the tumours and they'd be as hard as rocks. You know, they were like granite. And then after you'd have a treatment, there'd be a softness. They were disappearing.
That's 28 years ago.
That's 28 years ago, yes.
It takes a great deal of desperation to go to a practicing expert, an oncologist, a specialist, and then say, well, I don't believe what you're going to say. I'm going to go and see someone who you reckon is a charlatan.
Well, our nursing friends are sceptical. You try to explain it to them, there's no quackery about it. And Dr Holt is definitely not a money man.
Oh,
no. You know, a lot of us think he should be called St John. He's such a wonderful person.
Cancer is the biggest killer in Australia. Dr Holt has been curing cancer victims, or at least making them feel better, for the past 30 years or so. And he's done it for next to nothing. In the same time, we've spent hundreds of millions of dollars on cancer research with very limited results. So what's it going to take for governments or the cancer councils or the cancer experts to finally recognise what this bloke does? Is it cynical? Is it too easy to talk about a medical conspiracy?
Well, I don't think it's a medical, it's a scientific conspiracy, I'm sure of that. I'm not sure about medical.
Is it frustrating to you? Is it disappointing to you? Is it upsetting?
Well, it was very upsetting, yes, at the time.
And now you've simply just water off a duck's back?
Oh, yes.
Do you wonder why? Do you scratch your head after all these years?
No, I've learnt to shut up and practice in peace and quiet and try and get the best I can, and I'm getting towards it. What I'm doing now is the most interesting thing I've ever done in my life, and frankly, I don't want to leave it alone, despite the fact that I'm getting old.
You don't feel like you should go on the front foot? You've done all that. You've now just decided to let those disbelievers go on disbelieving?
Yeah, sooner or later they may get cancer.
Do you look back on those 30 years that you've done this research with pleasure, with satisfaction, or with frustration?
Oh, great satisfaction.
Yes, indeed, as you should. A remarkable bloke. At the very least, it's time that our health authorities arranged a proper scientific trial of Dr Holt's treatment. It's soon going to be lost to Australia because it seems he is going to move to Ireland. He is, after all, as we said, approaching 79 years of age. And there's more on that story at our website. There's the address right down, or as usual, you can give us a call or write me a letter. Tell me about your personal experience with Dr Holt, and we'll